Reflux is a really common condition in babies, and usually it gets better by itself, so we don't really have to worry too much in most cases. Reflux is where you get an effortless regurgitation of milk, and that can either occur during feeding or just afterwards. It can actually be quite frequent, so it's worse than posseting because it can be a lot more than a posset, and it can be large amounts sometimes. The reason it happens is because there's a muscle at the top of our stomach called a sphincter, and in babies that's quite loose. So when feed goes down, it can come out again the other way. And it's because that muscle isn't that well developed, and as the baby grows and develops, that muscle gets stronger, and therefore reflux gets better with time by itself. Because the milk and feed can come up quite easily, it can be a little bit uncomfortable for babies. So they might, during or after feeds, they might get upset, they might arch their backs, and they might look like they're in pain. If you think your baby's got reflux and it's a problem, then please make sure you speak to someone like your doctor or your health visitor. They might advise you on positioning baby during feeds and afterwards, so sort of keeping them slightly upright to make sure the milk stays down in the stomach. You might be advised to use a carrier or a sling rather than a deep-welled pushchair or a car seat. Occasionally people find baby massage to be useful. There's not a lot of evidence around it, but if it's free and available, you might as well try it. And sometimes if reflux is really bad, there is medical treatment available. We must always remember that for some babies, reflux can be really severe, and that's really distressing for parents. So if you find yourself in that situation where you're just not coping, please ask for help. Nobody is going to judge you or tell you off for doing that. Reflux peaks sort of within the first 6 months of life. That's when it's worst, and usually it's settled and gone by about 12 to 18 months, so it does get better, but if you're struggling, please ask for help.